The health director with the United Nations Center for Disease Control and Prevention are on a week visit in the region to assess programs supported by CDC Namibia. During the meeting, Timotheus highlighted the need for continued awareness and diagnosis at Tsumkwe due to a high number of drug-resistant TB cases, where there are about 97 TB patients at all 4 health centers, of which 39 are drug-resistant cases.
Otjozondjupa region is one of the regions which, in Namibia, which is really having a challenge or challenged by TB. As you have been hearing and also knowing that we are having cases of resistant TB, especially in the constituency of Tsumkwe. This challenge has been there and is still there. And CDC and the Ministry of Health and Social Services are trying their level best to see how we can overcome this challenge. They are going to look into ways and means how they might scale up the current support they are giving to us.
UN Center for Disease Control and Prevention Country Director Dr. Brian Baxter said the visit is to look at how support of $1.5 billion is being utilized.
We have been in Namibia for over 20 years now. We provide support in all 14 regions, including, of course, Otjozondjupa. Our annual operating budget for that support is about 1.5 billion Namibian dollars. Our focus, as was mentioned, is primarily on tuberculosis and HIV, but it's also related to health system strengthening in related areas. And we plan and strategize about how we can help support Namibians with the resources that we're privileged to use here.
Otjozondjupa Governor James Werikwa raised concern over limited medical doctors at Tsumkwe. Currently, Tsumkwe health facilities are serviced by the Grootfontein District Hospital, about 275 kilometers away.
There is a need for us to put now what you would call a health hospital, a district hospital in that area or something of similar nature. That is through proper funding, because you know that already the Ministry of Health is already overstretched in terms of their budget. But be that as it may, Tsumkwe is the area with the highest TB rate in our region, to start with. Number two, also, in terms of the resistance of TB in the country, Tsumkwe happened to be the one that is topping. So we need to create a system whereby now the Ministry of Health have what you call the health promoters, the extension workers, that they conduct visitation at the various homesteads to assess the patients and see how best this patient can be assisted. So a program like that also needs to be beefed up.
Faith Sankwasa, NBC News, Oshuarongo.